Okay, let's talk about EHLER Danlos syndrome, also abbreviated as EDS. So, the EHLER Danlos syndrome is not one particular disease. Within EDS, there are different other disorders present. All the classical things that we usually talk about in EDS is that a person having hypermobility, his skin is hyperelastic. So, in this picture, these are the two classical pictures which depict hyperelastic skin. So these are hyperelastic or hyperelasticity of skin present. Whenever we talk about EHLER Danlos syndrome, we see these two classical pictures. Right. So it is a group of disorder, right, that result from defective collagen, in particular fibrillar collagen. So we get few important points that first of all, it's a group of disorder and not one single disorder of EDS. Okay, which are the types of EDS? We'll talk about sooner. Next, it affects collagen. See, one disease which is very much similar to the EDS is our Marfan syndrome. Marfan. So Marfan versus EHLER Danlos syndrome. People get so much confused. Today we'll try to destroy this confusion. So the EHLER Danlos syndrome affects collagen. Marfan was affected due to problem in the fibrillin protein. We know there are three different types of protein, right? Three important proteins. Collagen, elastin, and fibrillin. Right. So there are different disorders affect these three different types of protein. These important proteins are widely distributed in our tissues and it gives characteristic features to the different types of tissues, right? Their distribution plays an important role, right? So it's a group of disorder. Being said that, let's quickly discuss about the type of disorders. So EDS has various types of EHLER-Danlos syndrome. Before jumping on the types, I want you to understand that all the different types of EDS has some classical features. However, few features remains constant. First of all, EDS is problem with collagen, and collagen is among all these three important protein of collagen, elastin, and fibrillin. Collagen is widely distributed in our body. So because it is widely distributed, so different organ systems, structures will get defective in this case, right? However, at least few important symptoms will remain constant throughout the types. Okay, first one was the hyperelasticity of the skin. Second is joint hypermobility, right? At least these two problems are very much common. So whenever we have a patient with us and we suspect that the patient may have EDS, don't focus so much on the types. What is the type of EDS? Just focus at least the patient have hyperelastic skin and the joint hypermobility. Few also important clinical features may be present, but at least at instant time of diagnosis, focus more on hyperelasticity of the skin and hypermobility of the skin. These two important things will help you diagnose the patient better. Now, types of EDS. Let's go alphabetical order. It has A type, it has C type, it has D type, then H type, K type, and V type. Okay, all have different names. First one, A type. A type is also called as achondroplasia type. Let's write it like this: A EDS. The A over here stands for achondroplasia. Okay, then there is C type of EDS. C stands for the classical type, the one we study everywhere is the C type. Then D EDS. D type of EDS. D stands for dermatosparaxis. Dermatosparaxis. Then A, C, D, then comes the H type of EDS. H stands for kyphoscoliotic. Then after H type is K type. K type of EDS. K stands for, sorry, my bad. The H stands for hypermobility. Hypermobile. And K stands for kyphoscoliotic type. Kyphoscoliotic type. And lastly, the VEDS. The V over here stands for vascular type. Right. Now, let's see there are different types of prevalences. First of all, these data which I'm about to tell you is not fixed data, because most of the people who have this disease of EDS or its variants, they actually go underdiagnosed. Few of them are not even diagnosed, so the data can actually differ. However, the A type is extremely rare. And don't worry, we don't need to remember all the 6 type. These are the 6 major type. Okay, these are 6 major type that you must keep in mind. However, even from these 6 major type, 3 are more important. Which 3? I'll tell you. So first one was achondroplasia EDS. It is extremely rare. Then is C. C is roughly around 1 in 20,000 to about 40,000. This one is the classical type. Then the D type is less than 1 in about 100,000. So this is a rare variant. The H type is fairly common. It is about 1 in 5,000. Then the E type is 1 in 100,000. And lastly, the V type is, it ranges from about 1 in 50,000 to 200,000. These are the some statistical possible datas, right? So the H type, H variant is fairly common. Then the K type is again rare, and V type is also rare. Right. Though EDS is autosomal dominant condition, this is autosomal dominant condition. We'll read the EHLER Danlos syndrome in the category of autosomal dominant genetic variation. However, all the six major types, they are not necessarily have autosomal dominant pattern. Few of them have autosomal dominant, few of them have autosomal recessive type. Okay, so first one is autosomal dominant. Okay, second one is also autosomal dominant type. Third one, autosomal recessive type. Okay, let's change the color. This is autosomal recessive type. Then again, the H variant is autosomal dominant type, and the last one is also autosomal dominant type. And the K type is again autosomal recessive. So all the important autosomal dominant type we need to remember. I told you that among these six major types, few are more common. Which one are they? So at least remember few of them. The C type, remember this, the classical type, the hypermobile type, and the V type. Why V type? Even it is like so much rare, because among the all variant, the vascular one has highest amount of mortality cases, because the name suggests vascular, the vascular structures are more affected. Now let's talk about the genes and the protein. Genes again not that much important, but just to remember, if you want to remember, you can. The first one is A type. It is present on chromosome number 17. Which part? Q part. The classical type, it is present on two different chromosomes. Chromosome number 9, Q type, Q part, and chromosome number 2Q. Again, you don't need to remember all the chromosomes. Okay, if you still want to remember, just remember for C, H, and V type. Then for D, it is chromosome number 5Q. Then H type is chromosome number 6P type. Then for K, it has again two, chromosome number 1P and chromosome number 7P. And lastly, chromosome 2Q. So we have formed a kind of table. Let's change the color. Now let's quickly discuss about the type of protein. So we just talked about that EDS focuses more on collagen. So let's talk about collagen. On the chromosome number 17Q, there is a gene which is called as collagen, COL, abbreviated as COL. And type 1, there are again different types of collagen. We'll focus and talk about all that type of collagen in some other video. Right now, just remember it is COL1, A1 and A2 type. Again, for this one, this is collagen, COL, type 5 collagen, A1 and A2 type. These number depict which type of collagen it is. Again, it's a huge list of collagen. Right, for the third one, it is Adam TS2, which codes for two different enzymes and proteins. First one is procollagen. See, in order to remember EDS, you need to know how collagen is produced. So we'll talk about all the different types of collagen, what are the different steps in it, but not in this lecture, it will be so much long. And N-peptidase. See, there are different types of enzymes also involved in it. Now for the H type, right? For the H type, the problem with H type, even being so much common, okay, this is again so common in all of the types. However, the gene is still unknown. Okay, we don't know. Right. Anyway, it actually proposed that it might have some linkage and association with its gene associated with all the other variants. So maybe it can have association with the call 1, call 5, and so on. Anyways, right, for the K type it is plod gene, PLOD, plod gene, plod number 1, and FKBP14, FKBP number 14, and they code for a very important protein, which is lysyl hydroxylase enzyme. And lastly, the 2Q, right? This codes for collagen 3A1, which will form a collagen type 3, right? So this is a very important table to remember. Okay, this is a kind of base for us. Remember this. Okay, now we just talked about different types of collagen involved in it, right? So focus over here. We need to remember 3 important ones. Which one was it? It was C type, H type, and the V type, right? See, for the H type it is unknown, so it is nice for us. We don't need to remember so much. At least remember the call variants of all the genes. This one, call 1, call 5, and call 3. Okay, and for the rest of them, just remember that these are the enzymes which are involved in the processing and the formation of collagen, right? In some other video lecture I'll tell you all about it. Now, very well, let's see. So what is actually happening in this case, that either the collagen is defective, right, or the process by which collagen is produced, they have some kind of flaw in it. Either the enzyme can be the N-peptidase or the lysyl hydroxylase, or the raw materials needed for the production of collagen is defective, or it is less in the body, or somehow the body is not able to absorb those nutritions, the genetics, right? And all these kinds of things actually play an important role, directly or indirectly, right, in the formation of collagen. Earlier we talked about we need to focus more on MARF1 and the EDS, right? So the MARF1 was focusing more on the fibrillin protein. The EDS is focusing more on, MARF1 was focusing more on fibrillin. EDS is focusing more on collagen. Okay, also that we just mentioned for the collagen, there's also one more very important disease which affects collagen. It is osteogenesis imperfecta. So few of the features can match with the EDS. For example, the blue sclera, the characteristic feature for the OI, can also be seen in the case of EDS. However, that will not be the diagnosis in this case. Let's say there's a very what you can say, a patient may have a height of, let's say, 6.5 feet, very slim, lean. He has a hyperelastic skin, hypermobile joint, and he also have blue sclera. We will not make a diagnosis of OI. We will focus more on the EDS, right? So yeah, so depending upon the tissues, right, and all these 3 important proteins and their distribution in percentage give the features to that particular tissue. Now, we mentioned about collagen, and we earlier said it was affecting more of a fibrillar collagen, which means that there is also type of collagen apart from 1, 2, 3, 4, and 5 type of collagen. All the different types of collagens are again distributed in 3 main categories. Okay, so collagen is again of 3 major types. First one is fibril forming, okay, are interesting, are type of interest, right? Then there is fibril associated, and lastly is network forming, right? For the network forming, it is distributed majorly in basal lamina of tissues, right? For the fibril associated and the fibril forming, most of the areas of the distribution are kind of common, right? So for the fibril associated, it is more in cartilage, tendons and ligaments. Now the tendon, ligament and cartilage actually keeps the joint intact, okay? It provides strength and a little bit of elasticity. However, because of our defective collagen, the fibril forming and along with the fibril associated, right? Most commonly it is fibril forming, but fibril associated also get involved. So these two are very, very important for us. So wherever collagen is distributed in these two categories, that area will be affected, right? The problem is that the fibril forming is widely distributed. It is present in bone. Just name the area: bone, skin, tendons, ligaments, right? Then cornea, then cartilage, intervertebral discs, vitreous humor, and even the blood vessel. Okay, even few areas I don't remember. Anyways, these areas, see, majorly the body has these areas, and because of this the patient depict major three things. Skin has huge amount of collagen, right? The joint, the tendons, ligaments, right, they have huge amount of collagen, and because they are being defected, the patient will have hyperelastic skin, hypermobile joint of the joint. Also, there's very, very important things that in the eye, okay, let's say this is the cornea, eyeball, right? This is the lens. This was your ciliary bodies, right? And from the ciliary bodies there was suspensory ligaments, right? These ligaments will also get involved, and because of this, subluxation of lens can be seen in this case, and because of this the patient may have blurry vision initially. The patient even can go blind, okay? Once the lens gets subluxated, it can even get cataract, right? So subluxation of lens will have again its manifestation: blurry vision to about complete blindness. Then the patient can have cataracts, etc., right? So these are some important clinical features. However, the clinical features again vary depending upon the type of it. However, the main point, okay, I'll not say classical over here, the main thing that we need to remember for the EDS, the main clinical feature which is fairly common in all the types of variant clinical feature, okay, most common. You see, I can't mention one particular type because it will make us so much confused. So in all of them, at least 3-4 things remain constant throughout the types. So hyperelastic skin, hypermobile joints, right? There can be subluxation of lens, and because of that the patient will have other symptoms. Right, So we just said the patient will have hyperelastic skin. So because of this, trauma to skin will increase. The skin can go cracked, right? So because of this, the patient will have easy bruising. Easy bruising. There can be poor wound healing because of this, because of defective collagen, and collagen is required for healing of the wound. Poor wound healing, right? For the hypermobile joint, the patient can actually dislocate the joint. So joint dislocation is fairly common in this patient. So dislocation of joint. And also the patient will have chronic pain because of this kind of action. And for the lens, we already discussed, the patient can even have cataract, blindness, and so and so. Right. Apart from all these three, there's also one more point we can add, which can be common, is the teeth. Okay, these teeth are actually fragile in nature. Right, so these 3-4 important points, at least remember these three. Okay, these three are very, very important. You can even you can just say it is a triad. However, it's just my triad. There is no name for it. Just remember hyperelastic skin, hypermobile joint, and subluxation of the lens. Once you just find all these three things, or at least these two are even important on that. If even these 2 or 3 things are present, you can suspect that the patient may have EDS. However, which type? We don't know, right? So we can see more clinical features type-wise. So let's say A type of EDS, right? All the different variants have things related with only these 3 important things. For example, few will have more, or there will be hyperelasticity of the skin will be even severe. Some will have mild form. Hypermobility of the joint will have severe, more and less, and like that. So for the A type of EDS, there will be severe joint hypermobility. Also, there will be skin changes. Skin changes will have bruising, and bruising. There will be blue coloring of the skin on pinching. Skin changes. Skin can even tear. Okay, beyond the limit, of course. So in skin changes, bruising, and scoliosis in vertebral column, also vertebral disc also. Chronically, the patient can have scoliosis, kyphosis, or even lordosis, right? Provided some other things, the posture of the patient, and so and so. Anyways, A then is the C type of EDS. C was the classical type. So again, skin and joint is involved. There can be atrophic scars present, so everything remain constant over here. For the skin changes, atrophic scar is much common. Atrophic scar, right? And easy bruising. Then the D type of EDS. The skin becomes, because it is a dermato variant, dermatosporaxis type of condition. So for the EDS, again, the problem will be present in skin. So skin will be much more fragile, and it is severe skin fragility will be present. Cutis laxa can be seen along with the bruising. So skin manifestation, right, in this one will be more. Skin will be involved more in this case, in the dermatosporaxis form. The classical will have both the joint and the skin changes. For the H type focuses more on joint. So joint hypermobility will be seen. And because joint is involved, so pain and dislocation will be common. Dislocation. So as you can see, this type focuses more on joint. Then the K type of EDS. The K type of EDS will have hypotonia. The tonicity decreases. Hypotonia, joint will be laxity. Joint laxity will be there. There can be congenital scoliosis, congenital vertebral column problems, scoliosis, kyphosis, lordosis again, and ocular fragility. Remember dislocation, subluxation, ocular fragility. Right. So the K variant was the kyphoscoliotic type. So kyphoscoliotic name suggests it is a kyphosis, and let's mark it over here, kyphoscoliotic. Hypermobile, so it is more of joint type. Kyphoscoliotic, kyphosis and scoliosis, so vertebral column is more affected. Dermatosparaxis, it is more for the skin. Classical type have everything. Right, so where were we? The K variant is done. Then after K, we have the last variant, which is the V type of EDS. It is a vascular type. It is most severe among all the type. Okay, patient will have, yes, some classical features will be there. Skin, joints, so thin skin will be there, easy bruising will be there. So wherever in the body which system has huge amount of blood supply, mostly these are the organs, so they have issues related with this. So organ rupture, internal bleeding will be present, right? There can be even a uterine rupture can be seen, and much particularly it affects small joint and joint hyperextensibility will be seen. Right, now what's the best thing for you? If you can remember this table, good. If you can't, let it be, who cares? Okay, once we established these 3-4 important points, what we do is that we directly jump on how to make a diagnosis, right? So first thing, skin hyperextensibility. Second thing, joint hypermobility. And along with this, wherever the collagen is present, any place you can think of, they will have problems. Subluxation of lens, teeth fragility, and so and so. Right. So for the VEDS again, we said that it has highest mortality rate. How it is actually causing the high mortality? It affects the blood vessels, and the system affecting the blood vessels is the cardiovascular system, and the patient can have mitral valve prolapse. There can be aneurysm formation. Those aneurysm can even rupture, right? And classical one, aortic dissection. Okay, aortic dissection can be case which can kill the person. So aortic dissection, so we must keep a keen eye on the cardiovascular system at least, in order to decrease the mortality. Right, so the person who actually knows the Marfan, right, also knows now what EDS actually is. Now we get so much confused for the EDS and Marfan syndrome. These two are almost similar, okay, but some things differ. First thing, EDS affects collagen, MS affects fibrillin, right? First point. Second point, skin, severe skin elasticity, right? And all these things which is happening in the EDS or MS is because of the distribution pattern of collagen, elastin, fibrillin within the tissues, and the percentage distribution in all of them. So severe skin elasticity, we yeah, see over here, this was for the EDS, fibrillin was for the Marfan syndrome, right? So severe skin elasticity over here, severe joint hypermobility. The patient have normal height in this case, normal height in case of EDS. In case of Marfan, there's problem again. Over here, lens dislocation is more. Lens dislocation is present over here, right? However, over here, blue sclera is more common. Blue sclera is more common. Now let's see for the MS, Marfan syndrome. It is not that severe skin elasticity, so mild skin elasticity, okay, mild joint hypermobility, mild joint hypermobility, right? Both these things are again less severe than the EDS. Right, the patient will have tall height, plus the patient will have arachnodactyly, long fingers, arachnodactyly, and the patient can have pectus excavatum or carnivortum. However, it can also be seen in the case of EDS, right? The lens dislocation is more seen in lens dislocation is more common in case of Marfan syndrome, right? So what's the distinguishing factor, okay, is this thing, normal height and tall height. At least focus more on that if you are making a differentiating thing. Right, now let's do differential diagnosis, right? Let's do DDX first, differential diagnosis. So first one for the EDS is Marfan itself, Marfan syndrome, right? The second one is Lloyd's diet syndrome because of the receptors problem, right, which was so much similar as that of Marfan. Lloyd's diet syndrome. Then is osteogenesis imperfecta. Then can be cutis laxa, not that much important for us right now. Right, rheumatoid arthritis can mimic some of the features. Lupus can be there. Then fibromyalgia. And when they mention the Marfan and the LD syndrome, how we can skip very, very important one is the homocystinuria. I will cover the homocystinuria when I will talk about biochemistry later. Right, so these are the things that you should at least keep in mind while making a differential diagnosis. At least try to rule out the Marfan, LD, OI, and the homocystinuria. Okay, rest of the things you can still skip, and also don't miss fibromyalgia. Right, now how to make a differential diagnosis. So for making a differential diagnosis, there is one important thing of Bayton classification. Okay, I have one table for you. Right. This is our table which actually help us to differentiate whether the patient have EHLER Danlos or Marfan. You can check all of them. Right, I'll just keep it over here alongside. Right, now there is this thing called as Bayesian classification or the Bayesian scoring system. This is how we diagnose the patient, whether the patient have EDS or not. This is one of the important one, but not the gold standard or the only thing that we need to remember. What actually tells us that first thing, for making a diagnosis, the patient will have clinical features present, right? Family history again can be positive in this case, right? Sometimes patient may not have a clinical history, or most of the time what actually happens is that, oh, that person is only have a, you know, he's very long tall, right? The patient, so actually people while making a diagnosis actually ignore this thing that the patient may have or can have EDS as well, right? So for the Bayesian scoring system, we check for 5 things. First thing is the fifth finger or the pinky finger. You can check for the both of the palms. So if you can bend the little finger or the fifth finger beyond 90 degrees, right? If you can do that, you can get 1 point for that. So you get 1 point for each hand. So 1 point for left palm, 1 point for right palm, right? So 2 points from over here, total 2 points. Then for the thumb again, if you can touch your forearms, you can again do in the both the arms. So maximum points 2 points, left side, right side. For one for the left side and one for the right side. So maximum points again 2. One for the left side 1 point, one for the right side 1 point. The left thumb and the right thumb. The C is the elbow. If you can hyperextend your elbow beyond the 10 degrees. So beyond 10 degrees, if you can do that, you can again get 1 point. So 1 point per arm. Again, it has 2 points, right? Right side, left side. Right, for the right elbow and the left elbow. 1 point over there, 1 point over here. 1 point. For the knee again, if you can do it more than 10 degrees, you can have the same thing again for 2 points for the either side, right side, left side, right? And lastly, for the spine, if you can touch your palm, right, flat on the floor in front of your feet without bending your knees, you get 1 point. So 1 maximum point. These all are your maximum points. Higher the point, so overall max score is 9. Higher the number, greater the risk. For adults, if you have more than or equals to 5, because it was depicting for joints, we'll focus and say it is as mobility. So if you have more than or equals to 5, you have hypermobile joint. Then again for children, greater than or equals to 6. Why 6? Because children are usually more flexible than adults, so we just keep it still 6, right? So all these things actually help us to diagnose. However, just the Bayesian scoring system itself is not sufficient to make a perfect diagnosis. So note, very important, alone Bayesian scoring system is not diagnostic. You must check everything: family history, clinical features, what other systems are affected. And lastly, so this was for the diagnostic, right? After done with the biting scoring system and the patient actually have this thing or this thing, we can suspect that the patient may have EDS. Now, very important is the genetic testing, right? We can check for the genes. For example, in the case of classical type, which is the col5 type, both A1 A2 we can check for. So C type was col5 and A1 and A2. Alongside we can check for the chromosome number. Then C, then the D type. For the D type, pre-collagen and the N peptidase, right? Adam TS2, if you remember. Adam TS2, pre-collagen and N peptidase we can check for. ADK. In K variant we had the plod 1 and the FKBP14. And lastly, for the vascular type, col3A1. Okay, so what was actually I was trying to tell you over here is that once you have only these important feature, okay, we can make a suspicion that the patient can have EDS. Now, which one? Don't focus more on all these things, all these clinical features, because it's very easy to make a mistake over here, right? So what we do over here is that just have a guess thing, okay, and directly send him for diagnosis. In the diagnosis we can check which one is it. If it is a col5, it is C variant. Adam TS2, it is D type, right? So it actually helps us make a perfect diagnosis much more easier without applying more brain, right? Because remembering all these things is very hectic for us. So if you can remember this table, fine. If you can't remember, that's also good. Just remember the important variants, okay? Just remember these 3-4 points, these 3 important features, and just make a guesswork and just send into for the diagnosis. And very important is that why Britain is not a diagnostic, because naturally also people do some yogas, exercises, and because of that also the patient can have elastic body, right? Not elastic, the flexible body. Right, then we can also check for skin biopsies. So genetic, then after skin, the skin biopsies. In the skin biopsy we can directly check for the collagen distribution. So the skin biopsy will show collagen abnormality. Remember, we just said that the patient will have high mortality in the cases of the vascular type. Why? Because the patient can have MVP, aneurysm, and rupture. So we can have the ultrasound USG of the heart, right, alongside with the ECG, and all this will help us to at least check the cardiovascular system, right? Because the problem is that not necessarily that just in the V type of EDS the patient will have high mortality. The thing is that in other variants also there is defective collagen, and the defective collagen is also present in the vessels of the body. So all the different variants will also affect the cardiovascular system. However, most among all of them is the VEDS, right? So still, let's say if the patient will have classical, we still monitor the cardiovascular health of the patient. So go with the USG and the ECG of the patient to check the cardiovascular system, and we check for aortic root dilatation, mitral valve prolapse, etc., right? And then we can go with the CT MRI, X-rays, MRI, X-ray, CT, right, to check for other systems. Examples: scoliosis, aortic dissection, maybe. Let's right, hip dysplasia, hip dysplasia, and etc. You get it, right? Now, the thing is that we didn't mention the H variant of the EDS over here. H variant of the EDS over here, because it doesn't have any gene, so no gene, or the gene unknown, no gene studied yet or found yet, whatever. We don't focus on that. Right, so what we do for the HED, which was actually common, right? Hypermobile joint, fairly common. So how we make a diagnosis for that one? We make diagnosis clinically. So for the H variant of the EDS, as it has no genetic predisposition, okay, we diagnose it clinically, right? And yeah, while making a differential diagnosis, we were actually trying to at least differentiate Marfan, Loistides, and the osteogenesis imperfecta, at least alongside the homocystinuria. Right, so we are done with this thing, and lastly, our favorite: how to treat the patient. So there is no cure, only the management, improve the quality of the life. So improve quality of life, do the physical therapy, but not even that much that it can cause or induce trauma. So moderate physical activity will strengthen your joints and help relieve pain. Physical activity alongside the physiotherapy if needed, right? Now avoid high impact activities, avoid high impact activities. Then pain management can be done, right? Pain management with analgesia. Analgesics, right? The thing was that in this case, collagen was affected. So even few amount of collagen, if it is good quality, let's try to make it even much more better. So provide the micronutrients supplementation. Which is required for the production of good quality of collagen, right? Collagen, example, let's say vitamin C, right? Then enzyme based therapy, let's say it is N-peptidase or lysyl hydroxylase. You can do the enzyme based therapies for that. Enzyme based therapy, and we can check for the cardiovascular health by cardiovascular monitoring. Alright, so all these things were necessary for us to remember about the EDS. So yeah, this was all. I guess next video I'll talk about osteogenesis imperfecta, and I'll try to finish the autosomal dominant as soon as possible, because I want to start about other topic as well. Right, thank you for watching.